The anterior cruciate ligament is the ligament that's most commonly damaged in the knee that requires surgical repair. It's thought of, I suppose people will think of it as a sort of footballer's injury, because lots of people playing football get it. It's more common in women than men. So with the latest success of the female football team, those people are more likely to get an ACL injury. What the important thing is to think about what the ACL does. The ACL is a ligament in the middle of the knee. So I've got a model here, which connects the shin bone, the tibia, to the femur. And its role is to guide the movements of the knee. So if you don't have an ACL, you are less good at knowing where your leg is in space because it's not moving in the right way. Our role is to try and reconstruct that ligament so that your knee will move normally and function can return to a more normal level. It is quite a big operation. It's a life-improving rather than a life-saving operation. It involves taking a bit of tissue from somewhere else in the body, commonly the hamstrings or the patella tendon or the quadriceps tendon, and putting that where the ligament was by drilling a hole in the shin bone and in the femur and attaching it at the top and the bottom. That is then replaced with living tissue, and there's quite an extensive rehabilitation time. So when the ligament's first put in, it's really quite strong, but over weeks it gets weaker as the body breaks it down and replaces it with living tissue. It gets back to good functional level at probably 9 months in terms of returning to most sports. It's probably, or the evidence suggests it's not as good as it's going to be until about 18 months. It takes about an hour, but often there are other things happening at the same time. So when people injure their ACL, they may also injure the cartilages in their knee. Orthopaedic surgeons don't really like calling torn cartilages cartilage. They talk about the meniscus, which is the medical name for it. And sometimes they may need to be trimmed or repaired, which can add to the time of surgery. And sometimes other things that are less common need to be addressed. The type of ACL reconstruction varies according to anatomy and age and demand. The patients usually go home the same day, so it's a day case operation, although sometimes they can stay overnight. We expect people to be able to walk out of hospital. The ACL doesn't require a brace, but if there are some associated surgeries on the cartilage, the meniscus, you may need a brace. By 6 weeks, I expect people to be with a simple ACL walking normally. But as I said, I wouldn't return to football for about 9 months in the normal scenario. And you need to have an extensive rehabilitation program with a physiotherapist, together with warm-up exercises lifelong to try and reduce the risk of rupture of the graft or rupture of the opposite knee. Because once you've ruptured your ACL, you're at risk of rupturing the other ACL as well. You're now a rupturer. The success rate needs to be broken down. It depends how you measure it. The success rate in terms of failure of the graft is in the 90s over a period of time. But I would say that the return to absolutely the same level of activity is not as high as we think. Nearly everyone is better than they were. Quite a few people that we reconstruct who are perhaps coming towards the end of their sporting careers do not return to the same level and decide to cut down on some of their high-risk activities. And some of the quoted figures for amazing return to sport and returning to pre-injury level are not as good as we think they are.